Hello and welcome to Real Health. My name is Michael Porter and thank you for tuning in to the show today. Now, the incidence of fire and burn injuries in South Africa is said to be very high. With the temperatures cooling down as well, it means that most people will be looking for ways to keep warm during the wintertime. We thought it would be most appropriate then to put the spotlight on fire awareness and some of the things that we can do to prevent burn injuries. For this discussion, I'm joined in studio by Dr. Charl van Loggerenberg, who's an emergency medicine specialist. Now, Charl, being in emergency medicine, I imagine you've seen a lot of burn cases over the years. Why is it that the incidence of burn injuries is so high, and is it increasing as we continue forward?
Yeah, Michael, thanks. Great question. So for starters, yes to the first part of your question.
Right.
Incidence of burns is high in South Africa and Southern Africa as a whole, just by being a developing country. And I suppose that helps us zone in on the commonest causes of domestic burns, because one would have to separate them into burns that are accidents in the home, which is the common category, and that's probably what we're going to chat about the most today, versus burns in maybe either the industrial sense, the workplace sense, or something isolated in terms of, you know, a motor vehicle fire perhaps. Okay, so those are categories that are easier for people to understand. But why so many? It's really because of the uncontrolled spaces that people live and work in, right? So and the sources of heat and the sources of fuel that people use are typically not as safe as we'd like.
Right.
So we end up in a space where lots of people are using open flames or unprotected heat surfaces for either cooking or heating. And again, it's topical now as we start heading into the colder weather of South Africa. Look, we're not that cold compared to the northern climates, but cold enough still to warrant home heating. And again, if those are not sophisticated devices or well shielded, well protected, well insulated devices, they just become a complete home hazard. I think that really just puts it on the table as the commonest cause, really.
And what are the sort of the most common injuries that you're seeing? I mean, I think they also, we do need to create a distinction, because you've got sort of the high end, or the haves and the have-nots, and they are going to be different. So sort of, let's say suburban living, what would be the highest injury causes that we see?
Yeah, in terms of burn specifically, it's all, think about what are the heat sources in the home. So heat sources would typically be open flame, common, hot liquids, common, and hot liquids, could be something as innocuous as a cup of tea being spilt, right, through to the cooking pot on the stove, through to the heating of the room if it's an open plan type area. And most heating sources, if you think about it, are a potential burn risk. I mean, from something as modern as a gas heater that hasn't got a protective cover through to an open flame, it doesn't take a very hot surface to burn. So you could burn from just proximity to heat, number one, or a surface that got hot. So not just the stove top or the plate, but the periphery of the stove. And you imagine a little child, a toddler, puts a hand up to see what's in the pot kind of thing. Such a common scenario. They don't have to get to the pot and spill the pot. They could just put a hand onto the stove side. That's a hand burn straight away. So so the common ones, I think, to answer your question, those sort of domestic interactions with cooking and heating, and then occasionally the non-thermal burns, so things like electrical injuries. Remember, we've got different types of burns. So all burns at the end of the day are heat related. There's a heating element, but what's the source of the heat? So the commonest is what we call thermal burns, which we've been talking about. So the flames, the hot liquid, something where the source of heat was obvious. But then we've also got burns where the source of heat's not that obvious. So electricity. So an electrical current going through somebody is actually generating heat. So the injury is ultimately a burn-related injury, right? And then the more exotic ones, we think of radiation injuries, chemical injuries, chemicals on the skin. Those are all a specialized kind of burn. But we see those, thankfully, very seldom, relatively. It's all about the thermal burns. I mean, in numbers terms, and the data's very, very sketchy if you try and get a sense of how many burn injuries do we actually see. Every article I read has got a different number, which kind of tells you that the data sources are a bit sketchy, but they do sort of quote quite big numbers, like we're talking north of 1 million burn events in South Africa, probably per year.
That's a lot.
Not that many of those end up in hospital, but we think that certainly gives us a ballpark figure. Certainly if you interrogate hospitals and ICUs and burns units, we're talking many thousands of burn injuries which are severe enough to go to a specialized unit per year.
Okay.
That gives you a sense of the quantum.
Yeah, there's so many legends and myths and old wives' tales about what you should do when you do get burned. I mean, what would some of these, maybe just to debunk a couple of them, I've heard of toothpaste and honey and butter and sort of just ice.
You're doing well on that list. You maybe forgot to mention boot polish. So let's make sure before any viewers get confused, everything you mentioned there, except the honey, by the way, we're going to come back to that.
Okay.
You threw that in as a curve.
Just on your toes.
Just to check that I was listening. So all of the home remedies, there is nothing at home off your grocery shelf that you need to apply to a burn in the home environment. Absolutely nothing. There's nothing in the fridge either that you should be applying to a burn. The only thing in the household that is commonly available, unless you've got something commercial and ready in your home first aid kit, and we'll talk about that just now maybe, but the only thing that you actually want to use is cool running water.
Okay.
And there's a very specific reason for that. It sounds a bit, that's a bit
hardly going to do anything.
That's a bit boring. That's not so fancy. He's an emergency medicine guy. He's talking about cool running water. Yeah. So cool running water is doing an amazing number of things to a burn. The mechanical flow of the water is actively drawing heat out of the tissue.
Okay.
So step one when we're treating a burn, in the immediately after the burn's happened time, is you're trying to reduce the severity of the burn, which is partly reduce the depth of the burn, okay? And whatever caused the burn in the first place, that heat is still there, right? So that heat is currently damaging the tissue.
So it's getting further and further in as you wait.
So the strategy behind burns management is take the heat out, right? And the best way to take the heat out safely and slowly is cool running water.
Okay.
The cool running water also helps because it washes off any associated gunk that might have come along with the burn insult, maybe the oil or the food or the tea or the whatever, or just dirt and contaminants. That's a great idea. So cool running water, perfect. Why not any of the other things you mentioned? Well, ice would sometimes sound like a good idea. You're thinking, well, that's one step further than cool water,
it's
right?
very cold.
Very cold. Ice doesn't work so well. In fact, ice has been shown to make potentially burn injuries worse because what it does is it shuts down all the blood supply because it's freezing things, right?
Yes.
So freezing tissue is never a good idea. Freezing tissue is just not good for local wound healing, local management, not a great idea. If you're going to grab something super cold, shield it, the cold, the frozen vegetables, wrap it in a cloth, wrap it in a towel so that it's cool.
Okay.
Cool is good, and we typically use that for like orthopedic injuries, twists, bumps and sprains. But in the burn setting, cool running water. Honey is a very sort of an ancient ointment in a way, and there are good studies, modern studies, that have demonstrated its value as a wound dressing. So not specifically for burns, but it is used by a number of plastic surgical centres for specific wound dressing management.
Because it does inherently have antibacterial properties.
It's got some wonderful properties. Honey's got some really good magic in it. So yes, there's an element of logic behind the honey as a post-injury treatment, but we're talking emergency stuff in the home, at work, in the workplace, absolutely nothing, including the honey. Cool running water, that's it.
Now let's go into what you might have in your first aid kit. And I know that Burn Shield is a product that is in so many first aid kits because it's got, it has that cooling action. Tell us about what makes that something that you really need to keep around the house to treat burns if they're going to happen.
Very clever product actually, in the sense that, and there are not that many options to go for in emergency burns management in the home. That's why I'm particularly fond of that type of product, because what's essentially happening is, number one, is it's giving the person something safe to do with the burn. Okay, so it eliminates all the toothpaste, boot polish, and that, right? Because it's now, right, I've got a burn, I need to use this stuff, right? So number one, we've got a safe option. Number two, completely sterile. So you're not adding any dirt or contaminant to the wound. Number three, the way the product is designed, it's a foam that's impregnated with a sort of a liquid gel, if you like, and that liquid is the anti-burn property or the healing property, right? And what that does is it allows for a non-adherent, so it's not sticky, and we can take it off. When the patient arrives to me in the emergency unit, I need to be able to have a look. So I want to be able to take off the first aid management
without doing any more damage.
Exactly, and crack on with the medical management. Right. So we need a dressing that is easy on, easy off, step one, and because of the particular chemical nature of these hydrogels that sit within the foam, wonderful sort of dual purpose of helping to take a little bit of the heat out.
Yes.
So it becomes almost the modern running water alternative,
yes.
right?
Especially if you're out maybe in bush or something.
And I say cool running water like, oh, well, just cool running water. But cool running water is not necessarily immediately available to everybody.
Absolutely.
Right? At that point in time. So if you've got a little travel pack or a work pack or a kitchen pack of this foam gel that you can pop on, wonderful.
Okay. And in terms of sunburn, which you spoke about earlier, would that be something that if you've got a severe sunburn, you can kind of also treat with that?
For sure.
And Charl, in terms of severity of burns, when do you say, okay, now this burn is bad enough that we need to actually go to see a professional, go to the hospital?
As the emergency guy, I'm almost tempted to say, bring them all to me first. And then I'm just thinking, I'm going to get a whole raft of these really small things. Person pitches up with sunburn. We heard you talking to me, and you said you must take all of them to the emergency unit. So please don't bring your mild sunburn to the emergency unit. Let's say that straight away. So typically the way we'd try and understand whether a burn warrants medical assessment would be, number one, if it's bigger than, I like to say 1% of your total body. Now you're going to say, well, how the heck do I know what's 1% of my body?
What's the reference point?
Size of your palm.
Okay.
So the size of the patient's palm is roughly 1% of their surface area. So if the burn is bigger than that, that's really quite a big burn. So
absolutely.
Something smaller than that, you could start considering home. Point one. Point two is, if there's any suggestion of a deep burn, so in other words, not the superficial, partial thickness, old terminology, first degree burn, the bad sunburn.
Yes.
How do you tell if it's deeper? Well, the deep partial thickness burns, the old second degree burns, they would be the red, weeping, blistering, like painful, like the most painful thing you've ever felt in your entire life, times 10. Okay, so those are the most painful burns. So if you see blistering and hectically red tissue and weeping tissue, second degree or deep partial thickness burn, hospital, right? Doesn't matter how big it is.
Okay.
Just if it's that deep, we want some professional management.
Right.
And then obviously if it's gone beyond that, it's the sort of Luke Skywalker number, and the tissue looks dead. If the tissue looks, and that's the full thickness.
So went all through all the layers of skin.
And funny enough, that burn injury is actually not painful anymore because all the nerve structures are in the skin. So in fact, if someone has been burnt and the wound or the lesion, wherever it is, they're not describing pain, that's actually a negative sign.
So that's definitely a hospital visit.
Definitely a hospital, because that's actually going to require a skin graft.
Okay.
That skin is dead. The skin is not going to repair itself. We need to replace that part. So the depth of the burn, size of the burn, and then the last one is, shall we call them sensitive areas? Okay. Hands, feet, face, genital areas, across big joints.
Right.
Anything that's going to restrict movement or potentially impact body function. Or affect appearance, because we'll need a good cosmetic function. A facial burn on a child that's badly managed can leave a scar that's going to now compromise this poor child forever. And it might be that we could get a better result with early management. So that I think gives people an idea.
Fantastic. Charl, lots of information there. I hope that people are going to just be more conscious of how they deal with burns. And thank you for sort of debunking some of those myths as well. Great to have you with us.
It's a pleasure. Great to chat.
Great.